Hi, today we're going to simulate what it feels like to use sutures and apply iodoform gauze in a wound site. So what we need for our equipment is a iris scissors, hemostat, and we'll also use a needle with a 3/0 silk suture, and of course you have a hot dog. So I'm going to make an incision in the hot dog. It's about 2 inches, 2 to 3 inches. It's a little longer. So you want to go deep enough so that the gauze could fit into the wound site. So that's it. Now I'm going to go ahead and obtain a piece of iodoform packing strip. You want to cut about 1 to 2 inches. In an actual patient, it's actually longer. Purpose of the iodoform gauze is to cover the bone. What happens is the clot dislodges from an extraction site and you have exposed bone. So it takes about 7 to 14 days for the cells to cover that bone. So what you want to do is cover it with this iodoform gauze for about 7 to 14 days, and you change the dressing every 2 to 3 days. So how we normally insert it in the wound site is with the hemostat in this manner. So you go ahead and pack it in like this. So you have it nice and firm and covering the bone. And what you want to do is break out the suture. You go ahead and take your hemostat and clamp it right here at the base. So the action, you're going to hold the hemostat in this manner so you're able to manipulate the needle in this manner. Okay? So this is the wound site. So you want to go about 3 or 4 millimeters from the wound. And you insert the needle like this, and you bring it about the equal distance coming on the other side like this. Then you release it in that manner. You take the tip of the needle and you bring the suture forward. That. And you want to leave about 4 inches. Leave the end of it like that. So you take this suture and you want to wrap it. So I'm wrapping it clockwise. 1, 2, 3. Okay, and you grab the tip of the suture like that and you pull it through, and you want to tighten it. You don't want that knot to be right above the wound site. You want to be right off the cut. So you see how I'm suturing it like that, and then you tighten it like that.
And
okay.
why don't you want it to be above the cut?
You don't want it above the cut. The problem with hot dogs is that they're not very firm, and you can see I kind of ripped that, but yeah, you don't want it above the cut because the tissue layers have to heal, and you don't want anything interfering with that. And then you want to go ahead and cut it. Leave about 3 to 4 millimeters of suture material like that. So I'm going to do that again. I'm not going to pull it as hard. I pulled it hard like the thing with hot dogs are, you think it's like real tissue, but it's not. It's really, really thin and pliable.
So can you explain to the students why you're not doing like lacing it like a shoelace and then doing one big knot at the end? Why are you doing individual sutures?
What happens is if that suture comes undone, the whole suture will come off. So if you have interrupted sutures, if one comes undone, you have the rest of them there to hold the wound together. So let me do this again. You just come in here. The thing with hot dog is very, very...
We should have them do a gingival description on the hot dog.
So, like this, like I said, pull it through. Just be gentle with the hot dog because it tears easily. So, some providers do 2 loops like that, some do 3. Let's try with two loops, and then you just grab end of it like this, and then you pull it. And try not to pull hard because hot dogs, as I've learned, rip. Counterclockwise.
So you did that one twice.
And then another one. Three times. Let's go with it. Okay, so there's that extra knot right there. I'll do that again. You know, we really need chicken to simulate real tissue. When is it gonna?
I can do chicken.
Yeah, cause see, I'm trying to.
The hot dog is too friable.
Yeah, see, it just pulled off the suture there.
Mm-hmm.
So. This is another. Okay. One. Do that again. Let's keep it simple. Okay, say just two loops. 1, 2. Clockwise. 1, 2 counterclockwise. It's good like that, or you could do another loop like that.
So we were going to leave this in the patient's mouth for 2 to 3 days.
Oh, yeah, most dry sockets you just leave the dressing in there without suturing it.
Okay. So now,
but
let's say this person's back, and now we want to remove the suture.
okay. Let's say you're just like I took a wisdom tooth out, and then I need to put the sutures, and they usually come back about 7 to 14 days.
Okay.
So
if this were a dry socket, they'd only place the suture if it was like a really huge gaping hole or something like that.
yeah, the 2 sutures if it's really large, and the gauze cannot be maintained in there properly. You need to close it. So removing the suture, you just
Should they
Staying
pick up
away.
one end with the hemostat and then do that?
yeah, they could do that, or cotton plier.
Mm-hmm. Or a cotton plier, okay.
Hold it like that. Just like that, and then you pull it.
And make sure they got the whole thing, or else what can happen? Thank you, Dr. Kamesa.
Infection though, right?
What was that?
If you don't get it out, you can get
Yeah.
an infection.
Mm-hmm.
Yeah. That's why we now, I haven't used the Idofront gauze in like